Hello everybody, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. You know, once in a while I'll just do a video where time isn't urgent, meaning that I'm just going to take my time with this topic. So I'm going to tell stories. So if you want to watch the whole video, I know it's going to be a long video, grab some coffee. So I got my coffee. The reason why this video is going to be long, because I want to talk about the many symptoms in the ear, hearing, tinnitus, sound sensitivity, auditory hallucinations, and the potential structural cause for these symptoms. You'll notice here that I have a hearing amplifier or hearing aid. So I want to talk a little bit about my own journey, and then we'll get into the pathophysiology of it. If you have tinnitus, ear pain, sound sensitivity, you've been diagnosed with semicircular canal dehiscence, Meniere's disease, you have ear symptoms or hearing symptoms, muffled hearing, you're hearing hums, high-pitched sounds, you're worried that you're going to lose your hearing or you've already lost some of your hearing, I really encourage you to watch this whole video because I'm really going to dive deep into the pathophysiology of it. And the great thing is, if you have a structural cause of your ear or hearing symptoms, there's a lot you can do about it. And in some instances, all the symptoms can be reversed. Well, say we go back about 2 months, 2.5 months, my wife was like, you got to turn down the TV. Like, in other words, I kept wanting to have the volume. I had the volume at about 63, you know, on the remote. And she's like, you've got to turn it down. Well, that was the final straw where I figured, you know, I probably do have some hearing impairment or something. So in the past, even in my 30s, I'm 62 now, even in my 30s, I had taken hearing tests. You know, because Marion's like, I don't get it. Like, one is, why do you talk so loud, right? So anybody who knows me, especially at restaurants, like we've been at restaurants and I'll just be talking, and then you could hear the other tables looking at, like, why is that guy talking so loud? Well, what happened was I finally decided to go online, I got hearing amplifiers for my right side and my left side. I didn't, you know, so it's not like these aren't expensive. And I put them both on, you know, and hearing devices are so easy. Like, all you have to do is, you know, put a battery in, then, you know, you could hear the little making a sound there, and then you just adjust it. You just adjust it. So I must have, okay. So yeah, but they're so easy to use, and the batteries are really inexpensive. Like, even when I'm here, yeah, I can tell my voice. I can hear my voice now more. So then, because I can hear my voice now more, then I talk softer. You know, like, in other words, right now, it appears to me that I'm talking louder than I did before. So it makes sense. So I put them on for the first time, say about 2.5 months ago with Marion, and right away she said, wow, you're talking a lot softer. And then when we were watching TV, the TV volume had to be way less. You know, so, and then, of course, then I was wearing them in the office. I'm wearing them in the office. And an unbelievable thing happened. Like, I couldn't believe the amount of energy I had at the end of the day. And I think what was happening was, unbeknownst to me, and I probably had this for decades, when people were talking to me, the patients are talking to me, the staff's talking to me, I didn't realize, like, the mental energy that I had to use to hear them, you know, to hear them. And it's probably, I probably was reading lips a little bit, you know, because when when I wasn't looking at her, my wife, and she's in another room or this or that, it was very, very hard for me to hear her. So the surprising thing to me was how much mental energy, how much more brain energy I had, how much less brain fog I had just by having hearing amplifiers. So I'm going to ask Izzy, I should keep this in or I should take it out, because I can do either one. Well, why don't we just do this? What I'll do is I'm going to do the video how I normally do, but I just wanted to give you guys a little idea of my journey. The other thing I would say is, even as a kid, I always had allergies. You know, I had allergies. I was a kid who, from the age of 7 to like 17 till I went to college, I got allergy shots at the allergist, like for, you know, weeds and ragweed and different things, a few foods. Then in medical school, my hay fever started acting up again. And then I got allergy shots in med school. And then one day in med school, I got the shot. So I'm in med school at University of Illinois. I got the shot, and I was somebody who actually always stayed there. You know, like they always say you should stay there and then make sure nothing happened. Well, long story short is I got the shot, and then I go out in the waiting room, and then all of a sudden, whoosh, whoosh, you know, like I get a rash. So by the time I walked back after the allergy shot, by the time I walked back and said I was having a reaction, I kid you not, I was going, like literally if I would have left and went down the stairs at the outpatient center, I might not have made it. Like they had to give me an epinephrine shot because of anaphylaxis. Well, it turned out they made a new batch for, you know, like in other words, when you get done with the tube, the solution, they make a new batch. Well, for whatever reason, I got too much or whatever. And long story short, after that, I stopped doing the ragweed shots. I just stopped. And the reason why I'm telling you this is I would always have symptoms in my ears. Like I would have itching in my ears. I would have fullness in my ears. And I just have a feeling the hearing impairment, that now the hearing devices, the hearing amplifiers are helping. I'm just telling you, I probably had it my whole life. So I'm just somebody who adapted and then could read lips some, and I just never realized like what was going on with me. So I just use that. So obviously this topic is near and dear to my heart. So I'm not saying that the only cause of hearing impairment and tinnitus and all these things is from ligamentous cervical instability or TMJ instability or changes in the neck curve. But if you're somebody who has tinnitus, sound sensitivity, you're hearing things that aren't there, or you're hearing like you're not hearing correctly, or you're starting to lose your hearing, I definitely want you to watch this video, because I'm going to explain what I think causes a lot of these symptoms. And I can say that because I've been treating people with these symptoms for 33 years. You know, I've been doing structural medicine. Most of the time, the cause can be corrected by getting rid of ligamentous temporomandibular joint instability or ligamentous cervical instability, and then correcting the cervical curve. And if people do that, it's incredible. Like I could give you a case example after case example. So this fella came to me about 6 weeks ago from Germany with all kinds of symptoms. Now, some of the symptoms were tinnitus, like he had tinnitus ringing in the ear, a hum, high-pitched sound, and then he had a whole bunch of other symptoms. And literally, he had had these symptoms for 17 years. Then we did the analysis in the office that related to we put him in different positions to see if his jugular veins were compressed, which they were. We did structural analysis where we did motion scanning to see if there was ligamentous cervical instability, which there was. There was all kinds of problems with his neck curve. So we got him on a specific kind of neck curve correction. I explained to him in a certain position, when he laid down, his jugular veins were way more open. So I just saw him this week. So I'm taping this on a Wednesday. So I saw him Monday, 2 days ago. And I'm like, you know, Jurgen, how you doing? I mean, his name's not Jurgen, but I'm like, Jurgen, how you doing? He's like, Doc, it's like unbelievable. Like in 6 weeks, probably like 50% of all of his symptoms are better already, because he now knows what positions block his jugular vein, and realize the ear is inside the brain. Your ear, basically, the ear nerve and all that stuff is inside the brain. So anything that inhibits fluid flow or nerve impulses to the brain or from the brain is likely going to affect the ear and hearing properly. So long story short, we got his jugular vein somewhat open already, and already tinnitus, and his hearing is better, and a whole bunch of symptoms. So these are all the different symptoms. If we looked at this: buzzing in the ear, earache, a clicking sensation, decreased hearing, tinnitus, persistent buzzing, hissing, loud noises, hearing impairment, ringing in the ears. All these things can be because of a change in the neck curve in a bad way. So I just call that cervical destructure. And this could be a 6-year-old. Teenagers, all of them. You can't be a 14-year-old and you're addicted to the cell phone and you're continuously looking down, because what's going to happen is then in the neutral position, your curve's like this instead of like this. So your atlas, the top vertebrae, by being so far forward, it's going to encroach on the jugular vein, and it's going to inhibit fluid flow out of the brain. What happens is fluid accumulates around the temporal cortex of the brain, which has to do with hearing, so you get hearing distortions. So when I say hearing distortions, it just means your hearing isn't quite right, or you're hearing things that you shouldn't hear, or you're hearing things incorrectly. So hearing distortions. Now I put this on there. This is really important. When somebody has a myriad of symptoms, to me, the more symptoms you have, the more likely it is it's going to be a structural neck problem, right? So there are people who all of a sudden they get vertigo or dizziness, right? Or all of a sudden they may hear something, they may all of a sudden get tinnitus, and it's just one symptom. Like when it's just one symptom, then you could do these things called Apley maneuvers. You go to a physical therapist, or you go to an ENT doctor. Like I had a patient one time where I looked into their throat, and they had these humongous tonsils, and they knew they were recommended to get the tonsils out even when they were a kid. And when I saw them, they were like 28, right? And I saw them after they had had a vertigo episode, and they were having some decreased hearing in the ear. And I was like, you got to get your tonsils out. And sure enough, the person got their tonsils out. Now they're in Europe. They married somebody in the army. They're in Europe. The wife does triathlons and all kinds of things, like completely healthy. No more vertigo attacks. Hearing's completely fine. All the other symptoms that they had went away. So long story short, so this particular patient came to see me, 17-year-old, and we found all kinds of internal jugular vein and vagus nerve compressions. And they had, these are just some of the symptoms: nausea, irritability, irregular heart rate. They had tachycardia, some hearing loss, fatigue, dizziness, some memory issues, some problem-solving issues, constant headache, brain fog. bilateral tinnitus balance issues. So in my opinion, the more and more symptoms you have, if you have a lot of symptoms, you have digestive problems, you have swallowing problems, you have vision problems, along with the hearing symptoms, like you're afraid you're losing your hearing, or you have muffled hearing, or you have tinnitus, it's more likely that there's a structural neck issue inhibiting the fluid flow out of the brain by blocking the jugular veins, which is easily tested in an office. And then that same compression on your jugular veins is actually inhibiting or impairing the vagus nerve input to certain structures that have to do with hearing. And then because the vagus nerve is getting degenerated, vagus nerve degeneration, and you document that by doing ultrasounds in the neck and showing that it's smaller, it's going to cause vagus nerve symptoms all over the body. So since the vagus nerve innervates the stomach, then your stomach doesn't work quite right, then you have bloating, and then you may develop all kinds of food sensitivities, may be constipated, may eventually get autoimmune diseases, and eventually get diagnosed with things such as mast cell activation syndrome, postural orthostatic tachycardia syndrome, SIBO, small intestinal bowel overgrowth. You might even have been diagnosed with chronic Lyme disease, chronic fatigue syndrome, fibromyalgia. All these things can occur just because from structural neck issues. And the thing about the excitement of that, if I can say that, is these things are correctable. You know, by doing cervical curve correction, which I'll talk about later, as well as having a pro-vagus lifestyle. So how do we hear? Sound waves, go into the ear. Basically, it causes a vibration of your tympanic membrane. That causes the stapes, incus, and malleus bones to vibrate. Then eventually, that causes an electrical signal in your auditory nerve. During this talk, I'm going to interchange auditory nerve, vestibulocochlear nerve, cranial nerve 8. Those are all the same thing. So the auditory nerve, sound waves come in, tympanic membrane vibrates, then it vibrates these bones, then the bones then stimulate electrically, basically, the auditory nerve. Then that signal gets interpreted by the brain, and it's the primary auditory cortex, which is in the temporal bone. So that's going to be significant because the auditory nerve and the auditory cortex are all in the temporal bone. So if you've been diagnosed with semicircular canal dehiscence, that just is where this nerve, where it's encased in the brain, is in the temporal bone. So semicircular canal dehiscence is some of the temporal bone has been worn away. Well, what would wear it away is there's too much pressure from the fluid, right? When there's floods, when there's hurricanes, the water has to go somewhere. So if all of a sudden the fluid flow of your brain is compressed right here, that's going to cause a lot of pressure on your brain. That's called intracranial hypertension. That can cause all kinds of fluid flow issues related to your eyes, so you get blurry vision, related to your hearing, so you get decreased hearing. And if the pressure doesn't get relieved, eventually you're going to get permanent damage of your auditory nerve, and that's what we call permanent hearing loss. And that's where people need hearing aids and all kinds of things. Okay, see how you have these as the ear canal, then you have the bones, then eventually this part of the nerve is called the cochlea. That's where we hear, and this part of the nerve is the vestibular part. So it's called the cochlear vestibular nerve. The vestibular part is where we get balance. So when you turn your head, the fluid will go into these parts and these parts, and it tells your brain where in 3D space your head is. So the auditory nerve and the balance nerve are basically connected, right? So that's kind of interesting, right? Because you see a lot of people with muffled hearing, hearing symptoms, hearing loss, tinnitus, but they also have balance issues, right? And I think these are primarily caused by a block in the internal jugular veins, which again is easily tested in an office, and I'll show you some ultrasounds of that. The great figure here, so I'm going to kind of go through this figure. The many potential ear hearing disorders caused by ligamentous cervical instability destructure. When I say ligamentous destructure, it means there's a breakdown of the cervical curve. In 1959, when they looked at 180 people, young people, older adults, only 3 out of the 180 had a reversal of the curve. So in other words, 98% of people had a cervical curve, and they had a deep cervical curve. That's 1959. I sent to the staff a study from 2012, it's just a normal study, that it was 40% of children basically have a reversal of the curve, right? Because they're just looking at tablets. And I'm telling you, it's going to cause a lot of problems. If you have a child who already is having hearing loss, I'm just telling you, you got to get them to look up. They got to look up. You got to get rid of this, them looking down at a cell phone and looking down at a tablet. And if you're a teenager, or you have a teenager, or it's you, and you're starting to have hearing loss, I'm just telling you, you got to get a lateral neck x-ray and see if you also have a reversal of the curve, and you got to restore your neck curve. So these are all the hearing and ear symptoms that can occur because of ligament damage in your neck. So what happens is, the problem is when you get in car accidents, or, sorry, there's a subluxation of a vertebrae here. So when you, in other words, when you look down at your cell phone, basically you stretch all the ligaments. The ligaments are the connectors of the bones. So in other words, when you're like this, you stretch out all the ligaments in the back of the neck. The process of that is called creep. Creep is the slow stretching of ligaments. So that's why when you're working, you've got to have your computer way up. You have got to use your muscles when you're working, especially on the computer. And if you don't, basically, the bones are going to go in ways that God never intended them, and eventually the atlas, the top vertebrae, goes forward, then it blocks the jugular vein, it starts banging on the vagus nerve, and eventually you get vagus nerve degeneration. So the hearing or ear symptoms are hearing sounds that aren't there, that's called auditory hallucination. Sound sensitivity is hyperacusis. Excessive cerumen production. If you're somebody who every 2 months you got to go to the ear doctor to get your earwax removed, this is Dr. Hauser saying the cause of it, and a lot of these symptoms can be other things such as food sensitivities. Like if you know you have a bunch of food sensitivities, yeah, obviously change your diet, gluten-free, dairy-free, or play around with it. If the fluid can't get out of the ear, the fluid then goes from the middle ear to goes through the tympanic membrane, and then it goes inside your ear. And then, so basically, cerumen is the solidification of that liquid into a solid. So that's basically what earwax is, excessive earwax, in my opinion. That's what causes it. So if you can get rid of the eustachian tube dysfunction, which can be from allergies, but a lot of times it's from a structural neck issue, then the excessive earwax production goes down. Because obviously if there's a bunch of earwax in there, you're not going to hear so good. So dizziness, balance issues, muffled hearing, tinnitus, ringing in the ear, improper sound sensitivity, which is called auditory processing disorder. That can be from structural neck issues. And altered sound perception is dysacousis. Dysacousis, again, you might, instead of hearing somebody laugh, it might get distorted into where you just hear somebody talking or whatever. So if you have any sort of sound distortion, like in my past, I've even had echolalia. Echolalia would be like I'm talking and it's as if it's echoing. It's echoing. But the most distressing, besides somebody losing hearing, like can you imagine like you're losing hearing, is sound sensitivity. And man, do we have a lot of people who have sound sensitivity. So I'm going to talk about that. So the whole brain primarily drains through the jugular veins. Like when the jugular veins are blocked, the brain will figure out other ways to get the fluid out, but the pressure still goes up in the brain and all the structures in the brain. Pressure's likely going to go up in the eye, pressure's likely going to go up in the eye nerve, in the brain tissue itself, in the hearing nerve. So eventually, over many years, all that pressure, it's going to cause the death of cells. So when you have the death of cells, that's called degeneration. So when you have when you have optic nerve degeneration, that's what causes vision loss. When you have auditory nerve degeneration, that's what causes hearing loss. So in other words, when you have a reversal of the curve, so see right here, the curve is this way, where here the curve is this way, and that blocks the jugular vein. So when it blocks the jugular vein, you have a dilation of all these veins. 70% of the fluid inside the brain is in the venous system. So if you block the main drainage port of the brain, the internal jugular veins, what happens is basically the fluid accumulates in the brain, so it squishes out the brain tissue. Your jugular veins basically are supposed to be totally open when you sleep. So what we do is we put people in different positions and figure out, like laying down, we put them in different positions and we figure out what sleeping position is best for the person. So then when they sleep, their jugular veins are maximally open, and we take measurements in the mid-neck and at the atlas, and the constriction almost always is at the atlas. Okay, I wanted to put this on, see the semicircular canals. So this, you see the TMJ, you see the semicircular canals. So look at this, look at the measurements here, 6.1, 2.8, 4.5. I put that in there because if you stick your finger in your ear and then you figure out where your jaw is, like it's right next to it. So there's a ligament called the Pinto's ligament. So there is a direct connection in most people between your TMJ joint and your ear, basically your inner ear, there's a connection. So ligamentous TMJ instability along with ligamentous cervical instability can both affect the vestibular cochlear nerve. So you see, that's what it looks like on upright cone beam CT scan. Here's the ear canal. Look at that, the ear canal here. Look at this, like the TMJ and the ear canal, they're right, they're connecting, right? And then right next to that is the semicircular canals, which is the bony portion of the temporal bone where the vestibular cochlear nerve sits. Okay, and then this is a drawing. So basically you have the ear nerve over here, the jugular vein is next to it, and next to it is the carotid artery. The pressure in the carotid artery, your arterial pressure in most of us is like 120/80 millimeters of mercury. In the venous system, that's a much lower pressure system, right? The arterial system is high pressure, 120/80. The venous system is like 5 millimeters, 10 millimeters, 15 millimeters. So it's much, much less. So what's going to happen is if you have a block of the jugular vein, like right there, because your atlas is too far forward, the venous system turns into a high pressure system. So once you have a high pressure system, I call that like a rip current. Like in Florida, right, that's the danger zone. Sometimes storms come through here and people don't realize there's a rip current right by the beach. So all of a sudden, the pressure of the water going out to sea is much greater, so people get caught in rip currents. Then before long they go out to sea, and probably around here every year, right, every year there's like 1 or 2 swimmers that drowned, and even a few days ago somebody by a drone, they dropped, somebody was drowning because of a rip current, and then somebody took a drone and put a life vest, you know, through the drone. Yeah, so they're looking at now in Florida of maybe having that be a way of how they save swimmers. Wow. So anyway, you can go to YouTube or whatever. But first, watch Dr. Hauser's YouTube videos before you do that. But no, I saw that YouTube video. That was amazing. It saved a person's life. But the same thing here, when you block here, then you start hearing the venous flow. In other words, the hearing nerve is here. You're not supposed to hear the venous flow. So if you hear the venous flow, it's humming. It varies depending on your neck position. That's a sign that you have jugular vein compression. So let me just talk about that too. And this is why I don't want to rush this video, because there's a lot of stuff where you at home can figure it out. So obviously I write a lot, I research a lot, even doing this, you know, it's a lot of work. So when I work as an artist, there just are times where I can't just have great posture, you know, because, you know, the creative mind, you know, I don't want to be restricted in any way. So once in a while what happens is, like, I'll spend the whole day writing or researching, and then I'll be in bed, and then all of a sudden I'll get tinnitus, you know, I'll get ringing in the ears. So if you move your jaw and the tinnitus, you can get a way for the tinnitus to go away, it likely means the cause of your tinnitus relates to your jaw. Or if you have the tinnitus, and what normally does it is you're in bed and you extend, or you put something underneath your neck where you extend, and then the tinnitus or the altered sound goes away or gets much less. That's a sign it's related to your neck. Now obviously if somebody has tinnitus or hearing distortion, and you have clicking, popping, grinding on that side in your jaw, or you have clicking, popping, grinding of your neck, you know, it's more likely than not that it's related to ligamentous cervical instability or ligamentous jaw instability. Now, ligamentous cervical instability to structure can cause all the things that we talked about. This happened to me the other day, myoclonus. It was just very brief. Again, there's just our days where Dr. Hauser has a crazy day and he just, you know, bent down a lot for whatever reason. And I was in bed, and then all of a sudden I heard click, 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 click. Like, in other words, like, I'm not moving my jaw, but I'm just hearing the sound click, 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 click. Well, that's myoclonus. So basically, tensor tympani myoclonus or stapedius myoclonus, both of those can again be from jugular vein compression. So if you've been diagnosed with tensor tympani myoclonus or stapedius myoclonus, the cause often is the neck, in my opinion, in the patients that I see. So all I did was literally for a minute, I hyperextended my neck, and then the myoclonus went away, and it hasn't been back. Okay. Kind of a lot of stuff here. I put these up here, not that I'm going to go through the whole thing, but let's just look at this. The potential pathophysiology involved in various ear hearing impairments from ligamentous cervical instability to structure. So in other words, you know, you have a reversal of the curve, or you have instability. So the way we would diagnose instability is we would do a motion x-ray, or we would do digital motion x-ray. So in other words, what we do is we put the person through lots of different motions. So we might, you know, and then it's like taking a movie camera picture, you know, like we would put them through various motions, because you can't often see instability unless you move, unless you do a an x-ray or video fluoroscopy with motion. So when people just do MRIs, it's not going to show the instability. You really have to do motion. You have to do motion. So basically, this can cause injury to the vagus nerve. Then basically you have decreased contraction of the levator veli palatini muscle, which is one of the muscles that opens up the eustachian tube. If the eustachian tube, which is the connection between the middle ear and the throat, like that's how the inner ear, middle ear balances pressure, like when you're going up in an airplane or you're swimming in a swimming pool, there has to be an equalization of pressure. When you have eustachian tube dysfunction, you can get excessive cerumen or earwax production, you can get muffled hearing, and eventually you can get hearing loss. Then because the vagus nerve innervates part of the ear canal, so if you have horrible ear pain, like you've went to pain doctors, you've went to ENT doctors, and nobody can get rid of just the horrible ear pain, it's probably related to your neck. It's probably related to your neck because you could have vagus neuralgia, or you could have upper cervical nerve root neuralgia, and that causes severe ear pain. Now, when you have ligamentous cervical instability or destructure, you can get internal jugular vein compression. So internal jugular vein compression can cause all these things. It can cause where there's fluid flow, where there's increased fluid and pressure on the temporal lobe of the brain, the auditory cortex. So then you get improper or altered sound perception. You get auditory processing disorders, hallucinations, or dysacusis. So just know, so the way to document that is, again, we would check to see if there's internal jugular vein compression in the office. Then we would do non-invasive testing for intracranial hypertension. So what those are is we look at the eye nerve, and is there fluid around the eye nerve? That's called increased optic nerve sheath diameter. When it's over 6.1, that means that the brain pressure is greater than 20 millimeters of mercury. And then we also look at pulsatile index of an artery, the middle cerebral artery in the brain. When that's high too, along with the optic nerve sheath diameter, that's very good evidence that the person has intracranial hypertension. Then what you can do is look at how much fluid is in the brain, and that you do that by an MRI of the brain, but you have to know what you're looking for, because there definitely are people who have increased fluid on the brain, but the report didn't say that. Now, internal jugular vein compression can cause excessive CSF and pressure around the brainstem auditory relay systems. So in other words, the auditory nerve goes into the brainstem, which then goes to the auditory cortex, and then you hear. Now, you can get excessive CSF fluid and pressure around cranial nerve 8, which is the auditory nerve or the vestibulocochlear nerve. Because again, it's a nerve. The vagus nerve, the eye nerve, any nerve that has to do with something significant in the body, if you keep putting pressure on it, obviously it could get damaged, and then you get permanent hearing loss. Now, I have had people that had hearing aids, now they don't have hearing aids. Like, I have had that happen. But it's much easier to treat somebody when somebody just started to have decreased hearing in the ear. So my advice is, if you're starting to get decreased hearing in the ear, please get checked for ligamentous cervical instability or cervical destruction. Like, in other words, when somebody's completely blind or they completely lost hearing in the ear, you know, it's very unlikely that some dramatic thing's going to happen, right? I do have one person right now that basically was told they were legally blind, and he is, for the first time in years, starting to see some light, right? And I'm not saying that he's going to get vision back where he can see me or see Izzy, right? But the point is, any disease, it's better to get it early, because it starts out with somebody has muffled hearing, right, because of these mechanisms, right? Then the same mechanism that caused the hearing thing causes the brain thing, and it's a progressive disorder, right? You have a loose screw on a hinge, like a cabinet door, and you keep opening out, closing the cabinet door. It isn't like the screw gets tighter, it gets looser. So all these things are progressive. So if you have pressure on your auditory nerve, and then you have pressure on your brain, what's going to happen? The brain fog gets worse, then eventually it gets to memory problems, then it gets to, ultimately, to dementia. You have, once in a while you have blurry vision, then all of a sudden you have blurry vision. Then all of a sudden you have where you have slight visual loss. Well, if you keep going, right, the number one cause of blindness in the world is glaucoma, high eye pressure. Well, then eventually you have visual loss. Well, the same thing can occur on the auditory nerve. Eventually you get certain frequencies you can't hear, then eventually you get permanent hearing loss. So in other words, excessive fluid, auditory neuropathy, you get irreversible hearing loss. You can also get so long story short, you can get conduction blocks. So the extra cerebral spinal fluid around the eye nerve can cause a block in the impulse. Well, those would be cases where we teach them how to open up their jugular veins during the night in certain sleeping positions. So that would be a person where it's like almost immediate, where they're like, oh my gosh, I hear so much better. That's a conduction block. It means the impulse is getting blocked, but the nerve isn't injured yet. So excessive CSF fluid can cause a vestibulopathy. If you've been diagnosed with Meniere's disease, some kind of vestibular migraine, or the doctor used the term vestibular, it's the same mechanism. It's likely from a structural neck issue. And again, when I say this, I'm talking about chronic symptoms. I'm not talking about somebody who all of a sudden got vertigo for the first time. I'm saying, like, you've had a chronic symptom and you've tried a bunch of things. They haven't worked, and it's likely going to be a structural neck issue. So vestibulopathy causes dizziness or balance issues. Like, I had a person yesterday, it was a new patient, and then I was looking at her test results. We do a bunch of tests. We do eye pressure. We see how reactive the pupils are to light. We do all kinds of jugular vein measurements, vagus nerve measurements. Almost all of our patients, the vagus nerve, when you try to see it at the atlas, you can't even see it. It's under so much pressure. And then we can measure it in the middle of the neck. And I was looking at her results, and I said to her, and then we do gaze stability testing. Like we see, is the right eye and the left eye basically seeing the same thing, if you will. Is the impulse getting to the brain at the same time? And her thing was abnormal. And I said, you have a lot of trouble in the car, don't you? And she's like, oh my gosh, it's horrible. Like, the things are going back and forth, when you're a passenger in a vehicle. Well, basically you have to look at so many things, and if your two eyes aren't communicating good, you end up getting dizziness and balance issues, especially when your head's moving a lot or your eyes are moving a lot. That was my main point. When you have excessive CSF fluid around the facial nerve, which is cranial nerve 7, your stapedius muscle doesn't work good. Remember I said sound goes to the ear, then the three bones, the stapedius, incus, malleus, they then vibrate. Well, sound sensitivity, most sound sensitivity is the stapedius muscle isn't working. It isn't working well. The stapedius muscle, that's what curbs or neutralizes loud sounds, right? So you need something that's going to protect your inner ear nerve to loud sound. So what does it is the stapedius muscle. Well, if the nerve supply to the stapedius muscle is inhibited, guess what? You got sound sensitivity. So again, Normally the treatment is we just got to open up your jugular veins, get the CSF pressure off of the facial nerve, then the facial nerve works correctly, and then you don't have sound sensitivity. Another muscle that dampens sound is the tensor tympani muscle. That's innervated by the trigeminal nerve. Now, the trigeminal nerve is famous for trigeminal neuralgia. It's horrible pain on the face. So somebody who has some kind of weird facial pain or atypical facial pain or eye pain or burning mouth, and they have a sound sensitivity, it could be related to the tensor tympani muscle is not contracting correctly. So that's another cause of sound sensitivity. When you have excessive pressure on the trigeminal nerve also innervates the tensor villi palatini muscle, which is another muscle with the levator villi palatini muscle that opens the eustachian tube. So again, increased pressure from jugular vein compression, increased pressure on the trigeminal nerve. The tensor villi palatini muscle doesn't contract normally. The eustachian tube is blocked. You could get muffled hearing. You could feel imbalance. A lot of pain, a lot of pain. Eustachian tube dysfunction can cause a lot of pain. I just wanted to show this is the auditory cortex. That's where you actually hear. So you don't hear till the electrical signal gets processed by the brain. Now, somatic tinnitus. Somatic tinnitus is where the perception of sound, often a ringing or buzzing, is triggered or altered by bodily movements, pressure, or touch. So if we look at this, right, when you have ligamentous cervical instability, basically you can get vagus nerve degeneration, internal jugular vein compression because the carotid sheath is compressed, and that can give you somatic tinnitus. Also, when you get upper cervical instability, you can get irritation of the upper cervical nerve roots. That can give it. When the vagus nerve gets degenerated, the sympathetic system is too active compared to the parasympathetic. So most disorders, when you Google the disorder, they'll tell you that stress makes it worse, right? Stress makes it worse. Well, in my opinion, in a lot of instances, the stress is making it worse because the people have so much degeneration of the vagus nerve, and the vagus nerve is not able to curb that stress. So whenever you get a stressor on your body, whether it's a stressor from a structural problem, a family member, work, the news, the stronger your parasympathetic system is, the stronger your vagus nerve is, the less that affects you, right? Like, we're all under stress, but your body's supposed to be strong enough to handle the stress, right? That's why I think most often it's not stress causing the problem, even though stress can make stuff worse. It's the person isn't strong enough to handle the stress. You know, and I'm not talking about, you know, somebody's getting beat to death or whatever. I'm just talking about the normal stresses of life. You know, the kids are sick, you didn't get a good night's sleep, this or that. The stronger your vagus nerves are, the healthier your vagus nerves are, the healthier your rest, digest, recovery, peacefulness, love. You know, all these things are carried through the vagus nerves. That's why vagus nerve degeneration is very, very serious, because you don't have something to curb the hyperactivity of the sympathetic system. And when the sympathetic system is so active, it can cause a lot of things. So one of the tests we do is called pupil diameter, right? Because, you know, like when you're under stress, right, your pupils are really dilated. So we just sort of document that's. And if you go on Google, there's a lot of research on how that's just a very easy test to do to see if somebody has sympathetic hyperactivity. And then when you have ligament injury, that means the ligaments they have trouble limiting destructive bone motions. When you have a ligament injury, the muscles tense up to limit that excessive motion. So the spinal cord isn't hit, the vagus nerve isn't hit. So if you're somebody who has hearing issues and you know that you have clicking, popping, grinding of the neck, you have kind of a constant muscle aching, tension in your neck, it's probably, again, through the ligament muscular reflex that your muscles are tight, not because it's a muscular problem, but because it's an underlying ligament problem, and the muscles are trying to stabilize your vertebrae there. Okay, the pathophysiology of sound sensitivity, hyperacusis. So if even your own voice hurts your ears, like it's just so loud, you're having trouble going out, you're having trouble even having normal conversations because it's so hurtful. It causes so much pain because the sound is so loud. That's called hyperacusis. So this figure explains how the reason why the person has it usually is the acoustic reflex. So the acoustic reflex we already talked about, where there's a loud sound, the stapedius muscle contracts. It limits the amount of movement of the bones in your ear, so then the electrical impulse isn't so excessive. When you have CSF accumulate around cranial nerve 7, the stapedius muscle, the nerve supply to it isn't there, so the muscle doesn't contract a loud sound. So when the muscle doesn't contract a loud sounds, you get hyperacusis. So basically you have a change in the neck curve, you have ligament damage here, it causes obstruction of the jugular vein, then basically fluid accumulates around the cranial nerve 7, then the stapedius muscle can't contract, and then the loud sounds, or even the voice, their own voice or somebody else's voice gets exaggerated. All the sounds get exaggerated. Now I wanted to put this in here because it's the same process. When the jugular vein gets blocked, the toxins can't get out of the brain. So the toxins can't get out of the brain, fluid accumulates in the brain. So what's that going to cause? Slight brain fog, difficulty concentrating, problem-solving problems, and eventually you get atrophy of the brain. And when you get atrophy of the brain or degeneration of the brain, then that causes dementia. Then you get full-blown dementia. So the treatment of it is you got to unblock the jugular vein. The way you unblock the jugular vein is to get a good neck curve, right? And then in the temporal lobes, remember we said that right here is where there's auditory processing. So if you get a jugular vein block, you get fluid accumulation in the temporal lobes, then you can get all these symptoms. You can get poor memory, cognitive decline, difficulty understanding language. You have problem-solving abilities, you get emotional lability, like all of a sudden you have a personality change, or for no reason you're yelling at people. You get anxiety, you can get non-epileptic and epileptic seizures like in children, and parents will tell us that we don't know what's going on, but all of a sudden it's almost like they're not there. They just like have this blanking out episode, right? So we document that the problem is related to either a CSF block or a vagus nerve block. Sometimes it's related to an arterial block from changes in the neck curve. So the reason why I put all these things on here is we very seldom have somebody where they just have tinnitus or they just have hearing loss. This explains to you that it's probably either there's vagus nerve issues or there's an internal jugular vein block from ligamentous problems. So you got to get tested for ligamentous problems in the neck. If you have ligamentous problems in the neck, the treatment that we do for that is called prolotherapy. Prolotherapy injections to the ligaments causes a tightening of the ligaments, decreases the amount of excessive motion of the bones, and then that combined with cervical curve correction, hopefully in our patients and all of our patients will open up the jugular veins and their symptoms will go away. Now, one of the things I do in a long talk like this, you'll see some of the slides twice, and the reason why I do that is I know some people are going to have a difficult time hearing Dr. Hauser for 2 hours, but they're just, you could see where I really want people to understand why they're having this symptom. Holistic medicine or natural medicine or dynamic structural medicine, what I call it, is we're always trying to get at the root cause of the problem. So if the root cause of the problem is a structural problem, right, it means that the person needs a structural treatment regime, not medications, not other means of treatment. Like, let's just try to treat it structurally if it's a structural problem. So basically, when a person has change in the neck curve, ligament damage in the neck, causes cerebrospinal fluid block, internal jugular vein block, fluid ultimately accumulates around the auditory nerve or vestibulocochlear nerve. See, there's excessive CSF causing excessive pressure, then eventually the nerve dies, basically. There's no way to cause sound to go to the brain to get processed, right? Okay, tinnitus. Tinnitus is crackling sound that you're hearing, humming, ringing, buzzing, roaring that shouldn't be there. So the most common reason I see it is because the fluid flowing through the vein is now heard when it shouldn't be heard. It's heard because it went from a high pressure system, it went from a low pressure system to a high pressure system because the jugular vein's blocked. So in other words, the hearing nerve is right here, the atlas is right here, so what? It's like 1 inch. So if there's a block here, you could see where the pressure right here is going to be enormous, right? Again, our patient, 17-year-old, has tinnitus. So is the best treatment one of these 25 meds? I haven't even counted how many meds the person had tried. And look at all these different tests the person's had or interventions. So this person literally just had what I said. They had a negative change in their neck curve got reversed. So the neck is the superhighway to the brain and from the brain. So what happens when there's an accident on a major highway where you live, right? It's a mess, right? I grew up in Chicagoland. Caring Medical was in Chicagoland for many years. When there's an accident on the Eisenhower, any of the highways, it's a disaster. So guess what's going to happen to the human body if the superhighway is blocked, right? Proper fluid flow into the brain, proper fluid flow out of the brain, toxic removal of waste products, so then neurotoxins basically accumulate all over the brain, in the eye nerve, auditory nerve, all the nerves. It's just a mess. It's a toxic dump. So what's going to happen to a nerve or the brain tissue or the eye nerve or the eye that has unbelievable pressure and it's in a toxic dump soup kind of a thing? What's going to happen? Well, the nerve's going to get damaged, right? The brain's not going to function right. Eye's not going to function right. Hearing isn't going to function right. So you get decreased hearing, you hear weird sounds, you get visual distortions, right? You start seeing flashes of lights, you get black spots, you get blurry vision, you get double vision. Yeah, all those things. Okay, so cervical instability causes the vagus nerve to not work right. You get ear fullness, tinnitus, decreased hearing and ringing. Ligamentous cervical instability pushes the carotid artery into the jugular vein, and you get pulsatile tinnitus. Pulsatile tinnitus is where you hear your heartbeat. When you get jugular vein compression, you can get hum tinnitus, or you can even get high-pitched tinnitus. This is a little bit more detailed. Cervical instability. It can cause head pressure tinnitus, venous hum tinnitus, pulsatile tinnitus, ear fullness tinnitus, sensory tinnitus, right? So that's kind of all the things we've talked about, all the different kind of tinnitus. This just shows the inner ear that there's fluid in it, there's perilymph. So just know the eye drains in the episcleral veins, the fluid of the inner ear goes to smaller veins. The smaller veins eventually go into the internal jugular vein. So in other words, if the superhighway, if you will, for the fluid flow out of the brain, out of the eye, out of the ear, out of the inner ear is the internal jugular veins. Guess what's going to happen when you have when you have a compression here, the perilymph is going, the pressure in the perilymph is going to go up, right? So when this goes up, guess what? You're going to get breaks in the temporal bone, and that break in the temporal bone is called semicircular canal dehiscence. So if you've been diagnosed with semicircular canal dehiscence, I did almost a 1-hour video on semicircular canal dehiscence. So I'd really recommend you guys watch that if that pertains to you. So again, semicircular canals. So long story short, the semicircular canals, that's what helps us with balance. So if you're having, if you feel like you're like on a boat all the time, that condition's called Maldebarkman syndrome. So if you have trouble being in a car, or you're just sitting there and you just feel like there's a floaty feeling or a lightheaded feeling, or you feel like you're on a boat, it's probably you have some extra pressure, extra fluid in your semicircular canal. So basically when you tilt, because there's so much pressure in all the semicircular canals, you're not getting the right input for balance. The fluid flows aren't normal, so then you really don't know where your head is in 3D space, and that's called Maldebarkman syndrome. Eventually you can get damage of the vestibular nerve. So again, you want to get at these things early. Like, it's not normal to feel dizzy. It's not normal like you're afraid to move your head because you're going to get vertigo or this or that. So my encouragement to you, you got to get it checked out. So even if you've had something for a decade, 10 years, 8 years, 2 years, it started 6 months ago, it's best to just get it treated early. So if you have balance issues, and again, see where you have the internal jugular vein, look at where the auditory nerve is, or the vestibulocochlear nerve is. Look at how close it is. They basically are right next to each other. And the mandible, the TMJ joint, it's all within here. So if you have balance issues, hearing issues, ear pain, tinnitus, you're losing your hearing, and you have clicking of your TMJ, clicking of your neck, consider getting prolotherapy to resolve the instabilities. Again, remember, basically the hearing, all the hearing apparatus is here. You have a block here of your internal jugular veins, and there's going to be increased pressure there. And you get all kinds of symptoms. Traditional medicine, they'll do all kinds of different things to try to help people with balance issues, Meniere's disease, vestibulopathy. And I'm not saying not to do those things. We normally see the person after they failed those things. Like they might have helped somewhat. They changed their diet, it helped somewhat. They did balance work that helped somewhat, but it's still disabling. So again, I'm talking about chronic symptoms. So you have chronic disabling ear symptom, hearing symptom, dizziness symptom, brain fog symptom. It's all likely the same mechanism, which is jugular vein compression. Ligamentous TMJ instability. So I'm just going to talk about it a little bit. Lots of patients that have had tens of thousands of dollars worth of jaw work or different devices and things. And I'm not saying the devices don't work, right? Like, in other words, there absolutely is a jaw component to some people's symptoms, right? So in other words, jaw position can affect, the upper cervical region, absolutely. But again, it's always trying to figure out what's the primary thing that's causing it, what's the structural lesion. So basically, when you have jaw subluxation, the disc in the jaw can extrude, you get jaw pain, stiffness, you can get clicking, popping, grinding, the jaw can get stuck. It can cause tension on the ligaments. There's ligaments that connect the styloid bone to the jaw, stylomandibular, stylohyoid ligament. So when you, for hours and hours and for years, you jut your chin out, that puts tension on those ligaments. Well, over time, that can cause the ligaments to calcify. That's called elongated styloid. So in our office, we do an upright cone beam CT scan to see if people have elongated styloids. Sometimes the elongated styloid can compress the jugular vein. It compresses the jugular vein from the front. That would mean that the person's symptoms are increased by flexion. So if you're somebody who's having trouble sleeping and your symptoms get way, way worse, when you wake up in the morning or in the middle of the night, it's probably that you're flexing your head. So try to sleep with your neck extended, and then get a test to see if you have an elongated styloid. If you want to get a test to see if the jugular vein is getting compressed by an elongated styloid, the test you'd get is a CT venogram of the head and the neck, and that should show it. Now, what we're talking about is jaw problems can narrow the space here, right? Because your jaw's here. It can actually cause internal jugular vein compression. There's a ligament that goes from the TMJ to the ear that's called the Pinto's ligament. So remember I said one day I was having like a high-pitched sound. I was having a high-pitched sound and, was new. So I just was moving my jaw and I could get the high-pitched sound to go away. So that's a sign that's related to your jaw. And just know cervical problems and jaw problems can actually lead to sleep apnea, because again, if the atlas is way forward, that can narrow the space where the airway is, or your tongue, when you put your tongue tip up, the jaw goes forward and it gives it more room. So another thing you can try is, I'm gonna not clench. You're clenching when your teeth are hitting. Teeth are only supposed to hit when you're chewing. So when you're just sitting there, your lips are supposed to be closed. Your tongue is on the roof of the mouth. When you do that, the jaw goes forward. That gives also the structures here more room. And then if your tongue is blocking the airway or your neck's blocking the airway, you could have snoring and sleep apnea. So there are structural causes of sleep apnea. The treatment is to restore your neck curve. That will give it more room. Then to breathe through your nose, not through your mouth. Have your tongue on the roof of your mouth, and then that will move this forward, so that can actually cure, if you will, or decrease sleep apnea. I talk about the eustachian tube. I just wanted to show a picture. So this is basically the middle ear. You have the malleus incus stapes. See how they're attached to the semicircular canal, the vestibular cochlear nerve. See that? And so sound comes in to your ear, the ear canal. Basically, this is the tympanic membrane. These vibrate. Then it's picked up by the auditory nerve. And to make sure that the pressure here is a normal pressure, basically this has to open. You might say, well, I don't get it. Why does this have to open? Well, you got to realize all this stuff is just cells, right? Those cells have metabolism. Every cell of your body takes in energy, right? That's why you eat. That's why you breathe. It has to get oxygen. It has to get dextrose. Like basically your food ultimately is broken down into D-glucose, dextrose, which is the normal carbohydrate that the cells use, and that's actually the carbohydrate that we use with prolotherapy is hypertonic dextrose. So because it's used by every cell, very, very safe. So then when those cells do what they're supposed to do, they cause the tissue to be healthy, they cause an electrical impulse. All that stuff then causes the cells to make metabolic waste products. Well, all the metabolic waste products got to get out of the body, right? So long story short, so if there's a jugular vein block, right, there's a fluid flow block there. The fluid has to go somewhere. So what happens is all this fluid then can start leaking through this. It goes in here. Guess what happens when it goes in here? You get earwax production. So that's what basically causes earwax production. And then basically this eustachian tube can get blocked by hypertrophic tonsils, food allergies, and of course, if the muscles here, the levator veli palatini muscle, tensor veli palatini muscle, if those muscles don't contract, because there's jugular vein block, which puts fluid around the trigeminal nerve, facial nerve. These won't open it. This stays closed. So then basically the pressure can't equalize there. Then you get ear pain. You can't hear. You feel dizzy, right? Because this is the dizziness. This is the balance nerve, right? And again, eustachian tube dysfunction can cause all kinds of distress, dizziness, vertigo, tinnitus, lots and lots of different things. Potential hearing symptoms from vagus nerve problems, right? So vagus nerve problems ultimately can lead to eustachian tube dysfunction and all kinds of hearing symptoms. And again, sound sensitivity, it can cause horrible, horrible ear pain. I have patients come in and they have noise reducing things that they put in their ear. So it can be very, very distressing. Once the jugular veins are opened and the nerve impulses to the muscles, like the stapedius muscle, are normalized, it can go away. Now, I just wanted to show the tests that we do for pulsatile tinnitus, one of the tests. So this is a CT venogram. See, this is the jugular vein. This is the jugular vein. See right here on the left side, the person had left-sided pulsatile tinnitus. So they kept hearing their heartbeat on the left side. See how the carotid artery is hitting there, carotid artery hitting there. See, the carotid artery is hitting the jugular vein. See, on this side, the jugular vein on the right side is totally open, block there, block there. So the person had increased pressure on the left side. They had tinnitus here. They heard their heartbeat, pulsatile tinnitus. So basically, the structural issues were pushing these two together. So once the person got their neck restored, had some prolotherapy, that thing resolved. And again, any nerve destruction in this can cause a loss of hearings, right? Because loss of hearing is the worst thing that can happen, right? In regard to the ear, it just means the ear nerve or the hearing processing system is basically destroyed, right? So we want to reverse this before either the auditory cortex, the brain stem, or the hearing nerve, the organa corti, is destroyed, right? So again, the earlier somebody comes in and gets evaluated and the structural cause treated, the more likely the thing's going to stop and hopefully reverse. The organ of corti is the inner workings of the hearing nerves. You have hair cells, and basically they cause an electrical stimulus to go into the auditory nerve. So sound comes in, the hair cells move, then the auditory nerve gets stimulated. And when you have ligamentous cervical instability causing compression of the carotid sheath, the internal jugular vein gets compressed. Then in the auditory nerve, the cochlear and vestibular ducts, where the fluid is, the pressure gets increased. It's basically the endolymph of the cochlea or the organ of corti or the auditory nerve. When that pressure gets increased, you can get sensory neural hearing loss. That just means that the auditory nerve or hearing nerve isn't doing well. It can also cause injury to the semicircular canal, which we talked about, and then you can get all kinds of things. Conductive hearing loss means the nerves are working fine, but the sound can't get in. Like if you have, like when I was younger, remember I said I had a lot of allergies? I'm just telling you, man, my dad and I would both be going to the ear doctor to get our earwax removed, and man, I would get my earwax removed and I'd be like, oh my gosh, can I hear so much better, right? So that's conduction hearing loss. It just means the sound waves can't get in. So when you get eustachian tube dysfunction, there's fluid in there, you can't hear as good. But the thing we got to prevent is sensory neural hearing loss, or the eye nerve from getting damaged, right? And you saw this earlier. So when you have jugular vein compression, fluid accumulates around the auditory nerve, and that's what can damage it permanently. So you got to get rid of this to not have the auditory nerve get injured. Now, if you go on Google, there's all kinds of things that they found in people who have auditory nerve damage, right? And I'm just saying that these things are occurring, but what's the cause of all this, right? Yeah, certain things happen with aging, certain things happen with diet, but you know as well as I do, there's people who don't eat so good and their hearing's fine. There's people that are 90 and their hearing's fine. What I'm saying is, could it be that the real issue related to hearing loss is that there basically is jugular vein compression, there's injury to the vagus nerve? And if that's the case, then instead of everybody looking down at a cell phone, we got to be looking up. We got to, when you're walking, right, instead of walking like this, like raise your chest. When you're working on the computer, raise your chest, use your neck muscles, restore the neck curve, and especially in kids, teenagers, man, they got to be looking up, not down. We look at what is the structural lesion, what can we do to get the neck curve restored, get the TMJ restored, not have a thoracic hyperkyphosis, like how do we get the structure restored, and then do we restore the pathophysiology causing the symptom? So if the symptom is tinnitus, does this restore the jugular vein? So with a normal lordotic curve, the jugular vein's open, the vagus nerve's fine. Well, the atlas goes forward now from ligamentous cervical instability, now it's blocking the jugular vein. Or you have a change in the neck curve and it's blocking the jugular vein, right? But you can even have a hump, like you're all humped over, that can block the jugular vein. Forward head blocks the jugular vein. The mandible can block the jugular vein, and we talked about an elongated styloid. So some people need the styloid removed. Some people need an oral appliance, or they need TMJ work. Other people need Pilates, and to restore the thoracic curve. Most of us need to stop looking down at cell phones, so get prism glasses so you look down at your cell phone through a mirror in a glass, but your head is up. So we got to keep our head up, and then we all got to raise our computers. What we can do in the office here is, again, check to see how can we get the person's jugular veins open. So sometimes we have people sleep in certain positions. We put head weights, neck weights. We could have somebody watching TV while they're doing the neck weight. So you can see where straight curve, we put the chest weight on, now they have a good curve. Then we look at the jugular veins. Here the jugular vein is pretty much completely blocked. We put the head weight on, now the jugular vein's open. So we can prove that the jugular vein is now open. And there's so many benefits to getting a cervical curve. You're like this. It means that the head's way out here. Well, the head weighs 12 pounds and it's sitting on a 2-ounce atlas. So it's all that's going to happen is the atlas is going to go forward, forward, forward. Like when you have a good neck curve, the weight of the head's behind the curve. All the structures in the neck, when you have a good neck curve, they're in their shortest position. So it means the jugular vein isn't under tension. The glossopharyngeal nerve, spinal accessory nerve, vagus nerve, the spinal cord isn't under tension, right? When stuff's stretched, when stuff's compressed, that's when bad things happen. What we'll do is we'll see what is the structural problem. Then we see what is their jugular vein diameters in different positions. Then we come up with a treatment protocol, right? So sometimes the treatment protocol revolves prolotherapy. Prolotherapy is to tighten the ligaments. Sometimes it relates to curve optimization by chest weights, laying on a Denerol, having somebody's computer higher. And then once we do that, then health gets to be restored, right? These are some suggestions here. So this is bad, this is good. So even in kids, teenagers, you got to look up. That's Morgan laying on a dental roll. Sometimes we'll use a dental roll or cutout pillow. That's the pillow that I have. This is a patient of ours who raised their computer screen. These are prism glasses. So Christina's looking at the paper, but her neck's up. This is me looking down at a cell phone, but at least in this position, you get a neck curve. This is Julie Hunt, one of the world experts in atlas adjusting, the Mayor Hunt Clinic in Clearwater. Wonderful people. And then me doing prolotherapy and using ultrasound to guide the prolotherapy. This is actually this is an image of showing what prolotherapy looks like. Most of prolotherapy is done in the capsular ligaments where the facet joints are. The facet joints are where motion occurs in the neck. Prolotherapy tightens the ligaments. You have a degenerated or injured ligament. It causes an inflammatory reaction with the goal of hopefully making strong, thick ligament tissue. So I guess I just want to end it. I want to thank you if you did watch this whole video. I hope it was informative to you. And I do really appreciate you guys being interested in this topic, because if what I'm saying is correct, that because of our face down, forward head lifestyle that we all have, almost 100% of the people on planet Earth have a cell phone. So technically, if everybody is getting addicted to the cell phone, and let's agree, the number one thing in the world right now that's addicting is actually the cell phone. So in other words, if basically the whole world is looking down at the cell phone too much, and that position stretches out the ligaments and it causes a destructive change in the ligaments. And that destructive change is causing the jugular veins to be blocked, and the brain pressure, the eye pressure, the ear pressures are going up. It's not good. It's not good. So together, right, together, we've got to get the word out, especially with our young people who are growing up in the internet era, and there's tablets and computers and cell phones all over. We have got to get back to looking up. We got to get back to looking up. We got to get back to using our neck musculature. And if we do that and our neck curves get restored, it's my opinion that a lot of health problems are going to go away, including the symptoms that relate to the ear and hearing.